sometimes stem wave. I'll go through that, but it's been actually around for a while. And I bought this machine during COVID 2020, and so things were a little slower. So I thought, what can I do? How can I improve my skills? And this kind of came up, and as you can see, so we'll go through kind of the science, how it works, and it's been around officially since 1980. That's quite a while. So what's that? 40-something years. That's a while, America tends to be pretty slow on accepting things, and I think it has to do about money, control, FDA, AMA, But it was used in neurology to break up kidney stones, and so it's sound waves to break it up. And so it's been around since 1980, and then they also started to use it for orthopedics, like fractures that weren't growing together properly. It's called non-union, and so pretty cool stuff. And so and so here's all the names. You also may have seen some commercials on TV for using Shockwave to help with ED, erectile dysfunction, and so that's getting pretty popular now. And so I'll show you, explain how that works. But I used to kind of call it Shockwave. We're really calling it Acoustic because shock sounds like you're going to shock someone's brain or something, right? And so Acoustic is more that has to do with sound, and it is actually sound waves. But also, this is the real official name in the research. If you want to research, extra means outside, corporeal means body, outside the body. So the treatment's coming pulse activation therapy. Sometimes this is excorporeal wave. This kind of changes, but that's kind of the underneath this. The third one is the Shockwave, ESWT, then stem wave, soft wave. People kind of market it as different things just to make it sound like they're doing something different, but it's really all the same thing. And this is what the big machines breaking down the kidney stones kind of look like, something like this. So you can see they were kind of big, kind of expensive, right? Who knows how much these machines were, and so really cost a lot. And so this is kind of how it worked on the kidney stones. So you have a kidney stones over here, and then you're sending, if you think of, you have a really still pond, and you drop a stone in it, and you see the ripple effect of those are waves. And so the same thing happens with sound. And so you have the sound wave. That's why you call it, they focus on the wave part of it, because sound moves in waves. But yeah, that's kind of, so it would break it up into smaller kidney stones, and then you can pass them easily. Yeah. Okay, pretty cool. And the first devices, they actually used to sit in like almost a bath in water and send the sound waves, because sound travels really through water. So it transmits, kind of like electricity also transmits through water. It's a good conductor. Yeah, so cool stuff. And I wanted to show you a video. Hold on. Tell me who. This is just a bit of some comic relief here. Okay. First one to guess where this is from. If you don't already know, don't. If you keep it quiet. If you know, keep it quiet. He's turning it way up. My wife's favorite movie. So that's what really high-powered sound waves can do, right? Rock and roll. Cool stuff. Alrighty. but pretty funny. But yeah, that's kind of sound waves move through things and really break things, right? If you think of thunder, right? Hello? What was I going to say? Yeah, like lightning, thunder, right? Or sound breaks glass. Okay, here we go. Okay. All right, so kind of where it started was, and so it's kind of a mechanical destruction of the kidney stones, and so really the sound waves kind of breaks it, disrupts the crystals, but then it also started being used in more regenerative medicine. Justin, can you just tell him to? I think that's my son showing up. Thanks. And then, so it's been used in a lot of, it went from kidney stones to like orthopedics, bone muscles. And so it's really, that's the non-union. And so it stimulated the bone to grow for some reason. In a non-union, the bones aren't growing. And so it really kind of shakes up the bone crystals. And then what we really use it, I haven't seen that because I'm not an orthopedist. I'm not in that realm, but I'd love to get into that. But we're working with really tendon issues. And if you think of every joint has a tendon, right, and ligaments. And so it really is going to help heal those. Skin lesions, I haven't got into yet. Ischemic heart disease. There's another, you'll see that it also increases the blood flow. That's a big deal. That's how it works in erectile dysfunction, improves blood flow. And then muscular disorders. So in Austria, the Austrian government, there was a chief of trauma, and the Austrian government actually used to pay for its citizens. If they didn't have a treatment that worked for something there, they would actually fly people somewhere else. And so they really looked after their citizens, their health, and they looked into this technology, and they said to this chief doctor over the trauma, chief trauma surgeon, and they said, hey, we've got this new technology. Can you test it out and tell us it doesn't work? And so he tested it out, and he found that it really works. And so they use it in I think they have about 8 different trauma centers in Austria. So they've been using it since about 1980, 1990s. And so this is a letter from him saying it works. So pretty cool stuff. And so if you want to do good medicine, you have to stay abreast of the times and use modern technology. Who had one of those? I don't know. I was too young for one of those huge phones, right? Remember the big car phones, And so now we use, flip phones, watches. I think the watches are going to go back to a hologram, Love it to see. So Minority Report. Anyone see that movie? Yeah. Anyway, but yeah, and so that. The machine, you saw how big it was in that room. Now it's getting smaller and smaller. And so I'll kind of show you how that works. But you want to be using state-of-the-art technology. There's the big one. Those used to cost $100,000. Now these machines cost tens of thousands. The treatments don't cost that much. It costs hundreds instead of thousands. So it's pretty cool. Like anything. The price of the treatment, not the machine. Right? Yeah, treatment. Yeah. So that says what, 10,000. Here, 100 to 600 a treatment. So. And you've noticed any top technology that comes out, it's really expensive in the beginning, right? And then it starts to get cheaper and cheaper as the machines get better and technology improves, right? And so let's get into, I want to actually show how this works. And so we have, so who hasn't, Brett, let's have you come up here, I think. And you also haven't even felt it, have you? Okay, so let me show you. So come up over here, you guys, and whoever wants to. And so it has like a little metal piece in here. We call it a bullet. And so let me see. So over here, just have a look over here. There we go. So you see this little thing?
I'm in the way.
Yeah, there we go. Just go to the side.
I was getting out of the way of
there we go.
The screen only to block the light.
And so over here, you see that little thing? And so it's a little piece of metal. And so this is basically a big air compressor, and we call it a pulse, and it shoots out some air, and it shoots it out at different rates, and it's got a metal plate here, and so this little metal, we call it a little bullet, hits that quickly, and it kind of hits that plate, and that causes the sound waves to come out, and so it does that, and so I'll kind of, and we set it at different rates, different frequencies. It's called hertz, and so it hurts. And so it almost sounds like a pinprick. But it's sound waves coming out, but it almost feels like something. And in the beginning, so we set at different rates. In the beginning, over here, it goes from 0 to 4. And we started up to about 1. It's not really that therapeutic, but it kind of numbs out the area a little bit. And so then we start to go up and ramp it up. And then by that time, sometimes when we're on the bone, it kind of vibrates the bone, and that's the most painful area, but we don't stay on that area. But also, the area where it's the most painful is actually where we need to work on. And so I don't usually believe in like no pain, no gain, but in this case, and it's almost diagnostic, and so that's why when we're doing it, we get feedback from the patient they're like, oh yeah, that's it, and so, and in the beginning it's pretty painful, but after about, I don't know, how long would you say it kind of gets better after? 1 or 2, 3 minutes? Yeah. So it's not too bad, So, so let me just, so kind of like that. And if I'm on the bone a little bit, you can see how that's more.
Oh, it's horrible pain.
Yeah. Yeah. But obviously where it's in, so.
Maybe I'm just really tough.
Yeah. But we ramp it up. That's the lowest setting. And so,
okay.
Does that make sense? Yeah.
Sure.
Stacy here. Yeah. That's not too bad. But if I go on the bone, you can feel that, a little bit more intense,
Yeah.
And so it's more like I don't know, it's like
More now.
yeah, kind of afterwave shocks, and it's like maybe a dull ache. I don't know, vibrations. How would you describe it? I don't know.
I think it's kind of like a really deep tissue massage.
Okay, yeah. Everyone's a little different. And the joints with more soft tissue, like shoulders are big. If I have a big guy in, like Britt, he won't really feel it. It won't hurt. But the skinnier the joint, the less soft tissue, it's going to hurt more because you're going to be most of the time on the bone and vibrating. But it is what it is. But and so, but as I said, it numbs it out. Sometimes you also use, where's my lidocaine, just, we got to roll on. And so just like, 1%, 2% alcohol, but basically just to numb it out. But so pretty cool. And so you can hear it. So every tap we call it a pulse, okay? And we do about, 6,000 pulses per area. And so what we're really doing is, let's see where, so it's kind of and the great thing about this is it's really diagnostic. So I said, as we're doing it, we're kind of finding where the area that we need to stay on, and then and what we do is we stay on it for a little bit, go away, give the person a break, come back, and then circle around. And so pretty cool. Let's see, it's one of the,
You need to go here next.
Yeah.
Because I can feel it here.
Right. Yeah. And so we go to usually insertion points of tendons, ligaments. Sometimes we're on the belly, but I usually know the problem areas, like in plantar fasciitis, it's usually the front part of the heel, usually, rotator cuff, it's usually around this ridge, so there's certain, what did I say? Rotator cuff, yeah. And then carpal tunnel, we've had so I've had the machine since 2000, but we've done a fair amount, but we want to do a lot more treatments, help a lot. But we've had a lot of success so far in certain things. Like I had a massage therapist that had bilateral surgery already, and she had 2 surgeries on this. And so she came in, I said, this was early when I was first using it, and I said, I'm not sure if we'll help, let's try it, The great thing is it's doesn't hurt. It's not it's reversible, you know. Where surgery, sometimes when they tighten tendons, ligaments, sometimes you can't go back, right? And you're changing the biomechanics. But so we did that, 6 treatments, and then she was a massage therapist, and she didn't know if she was going to even practice anymore. She was only 28. And then after 6 treatments, pain went all away. That was great. One of my favorite cases of a shoulder injury, this guy came in, and so we usually do 3 to 6, usually about 5 to 6 treatments. And so what happens is it usually gains momentum. And what we're doing is we're really creating some micro trauma, kind of a mini injury to that area. And so that gets all the cells to swarm to that area. And it activates the stem cells, exosomes. It's increasing blood flow. That's what angiogenesis is, and mechanotransduction. So angiogenesis is the production of new blood cells. That's how in erectile dysfunction it can help. And in the body, whenever you can improve blood flow to some area, you're in with healing. You can do a lot of healing. When you have certain injuries and you have less blood supply, that's when things die and they don't get oxygen.
What would this do with the meniscus?
Yeah, so meniscus, it's a kind of a ligament material. It doesn't have as much blood supply, but it all depends on the case. It'll help the tendons more probably than the ligaments, but as long as you can improve blood flow, and then you can also use other things. You can also put other things on afterwards to stimulate the healing, like herbs and that, so it kind of puts the healing process on, steroids, if you will. So yeah. Let's see. A mechanical transduction, that's what's really doing. It's kind of stretching and stressing out the tissues, and when that does, it kind of stimulates a biomechanical or biochemical response, and that's where the cells start to grow again. Genes can even express themselves, tissue repair. And okay, let me read this because this is a good description of it. And so it stimulates current cells to heal, so already the cells that are there, and attracts additional cells to that site, right? And especially it reactivates the stem cells, and then through a mechanical stimulus that causes a biological response in the treated area, which will stimulate and accelerate the healing process. Uses a unique set of acoustic pressure waves that act as a mechanical force at a cellular level. So it's really like stimulating the tissue on a cellular level to create a release of more proteins, increase neovascularization, that's new blood vessels, recruit the stem cells, and positively regulate inflammatory proteins. And so, yeah, just really almost tricks the body into a new healing cycle. So that's the whole thing. Okay, here's a whole list of benefits. One of the biggest ones is it's not invasive. No morbidity means that we don't kill people, right? Because surgeries, they're high risk, right? And so they also, no chance of infection, right? When you go and you cut, you can have secondary infections, which is a big deal sometimes in hospitals. And then you're not narrowing the future options of treatment. So, for example, say I break my arm and I have to have a plate in there or a pin. Now I can't go and get an MRI because I've got a metal piece. Does it make sense? And so also, yeah, that's just one case or one example. Scar tissue formation, whenever you're doing surgery and cutting, you're creating scar tissue, which is creating another problem. So, and then you're not changing biomechanics. So if I have to have pretty severe intensive shoulder surgery, they may tighten up a tendon and ligament, and you're changing the biomechanics. So my whole goal with my practice, I want to try and have the body to be in its natural state and trying to get it to work as best as we can. There's a time and place for surgery and drugs, right? But if you can, and I'm trying to improve biomechanics. And what I usually do especially with joint problems and with shockwave therapy or acoustic wave, I'm always also improving the biomechanics. So I want to bring the person into alignment, bring that joint into alignment, and then this is more an additional service if that doesn't get all the changes, because sometimes you have to go in and straighten and heal the tissue. So, for example, plantar fasciitis, which is a problem with the tendon pulling on the bottom of the foot on the front of the heel, and usually the cause is the hips are out of alignment, right? And it's causing the gait to be uneven and hitting the ground unevenly, and so it's causing stress. And so I'd go and realign the hips and the back and everything and the feet, but also sometimes you have to go in and heal that tendon. So, okay. And if there's any questions, go ahead. Let's see. Yeah, there's no restrictions. We're really trying to heal that the real problem to the tendon. Also, when I'm thinking of problems, you've got to try and heal or solve the problem at the level of the problem. So, for example, if you have a mechanical problem and a misalignment problem, you can't solve that with a drug, if that makes sense. It's covering up the symptoms, right? So you've got to solve it with a mechanical alignment problem. Same thing if you have a problem with a tendon, which is a mechanical problem, you want to solve it with mechanical solution. And this is kind of mechanical, if that makes sense, because you're hitting it. Yeah, it's not just a drug. And yeah, let's see.
Does this help, like, break up scar tissue?
Yes, I'd love to get more into that. Yeah. So one of the patients, he's got rheumatoid arthritis really bad. He's also type 1 diabetic. And so he had a big flare up a couple of years. And so there's all on his right side, he can't straighten this, anymore. And so in rheumatoid arthritis, that's a chemical problem like a biochemical problem. What's that?
Is that autoimmune?
Yeah, autoimmune, yeah. And so, but the flare-up's done with now, but he's left with scarring and damaged tendons and ligaments. Does it make sense? So we want to go in and help break up that scar tissue. Yeah. And just on arthritis, there are two main forms of arthritis. The one main one that most people have a little bit is called osteoarthritis. That's uneven wear and tear of joints, right? But then there's rheumatoid arthritis, which is more autoimmune body chemistry problem. And so we can help both at certain levels, but with rheumatoid, you've got to also take care of that, otherwise that's going to keep on destroying the joints. Okay, and so great thing about is in the literature in that we get pretty good results, and maybe 80 to 90%, which is pretty good with any treatment you're going to do. Most drugs is maybe, I don't know, 51 or 2%. No, but that's pretty good. Cost effective, we'll go into that a little bit. It's conservative. Great thing is you don't have to take time off from work or lost income. You can just go back to work, which is really good. So it's just going to hurt a little, maybe the next day a little bit achy, depending on the area. So that's huge. So here we go. But also it has like an analgesic effect. After that, people feel a lot more like looser, pain goes away, increased blood circulation. We talked about that. I'm excited to maybe help some people with this. So bone spurs, things like that, calcium deposits. I've got an X-ray of that because the bone spurs are a response of the body to stress, and so you can't really get rid of that anyway other than surgery or maybe doing this. So we've got a lady that she started having shoulder problems, and a couple of years ago, and I'm pretty sure, she was a friend of my wife, I'm pretty sure, I'm like, I think it's coming from her neck. And then she had shoulder surgery, and now she's having more problems all the way down the spine. I'm like, I think it's coming from the neck. So we just did one treatment already on her, and after the first one, she started to notice changes. So it's good. Okay.
What's the antibacterial effects?
Okay, so it's just increasing blood flow, activating all the cells. They're just more active, healthier, there isn't room for bad stuff to happen. It's kind of like, my whole analogy, if you think of a free-flowing river versus a pond. In a pond, what grows? Slime and yuck, because it's not flowing, it's not active. If you have a free flow, if you have good blood supply, I think that's going to really help that, Alrighty, okay. So here's a whole list. So if you're thinking of like, who could this help, right? Could this help me? Could this help that joint? And so if you think of your body, you go down the list. And so neck joints can be really tricky, you know. And so here's that plantar fasciitis. That's that pain at the bottom of the feet. Jumper's knee, that's usually that tendon in the front. Knee pain, back pain, stress fractures, overuse injuries. That kind of plantar fasciitis is kind of that. Shin splints. Shin splints, it's not actually the bone splitting. It's actually the muscle pulling away from the bone because of unequal. Yeah,
So
it's the wrong.
that on the front?
No, it's both. This muscle gets too tight and it starts to pull away from the bone a bit. But it's also, you got to look at everything. I would also look at alignment majorly there as well because it's a whole. Sometimes it is just people being hard on their body as well. Like I was in the military for a year, and so a lot of people got shin splints from just walking in hard boots and things like that. So sometimes it can be just straight trauma, you know. This one, foot ulcer pain, haven't done anything. Non-union, that's where we talk about those bones not growing together. Shoulder pain, rotator cuff helped. One of my famous cases, this guy came in and he had shoulder surgery before, and so I said, this was early days. I'm like, I don't know if we can help. Let's try it. And so we did one treatment. After the first treatment, he's like, wow, that's great. Range of motion's so much better. And then we did, and he prepaid for like 6 visits, and we got up. And then after the second one, he started having pain again. And then we said, let's keep going. And remember, these treatments kind of, they gain momentum, okay? And I've got a slide later where the greatest therapeutic effect is usually about week 12. So that's actually like month 3, okay? So he came in, so we're doing treatments 2, 3, 4, he's still having pain. 4, we did the 5th one, and he actually said, thanks for helping me, trying to help me. It didn't really help that much, and he kind of quit. We didn't do the 6th one. But then through his wife, a month and a half later, she called or whatever, I think she's still a patient, and she said, guess what? All his pain's gone in his shoulder. Pretty cool. And so it just had to take time to kind of go through the healing process. So,
So how long in between?
yeah, we usually do like, ideally is a week or 2, because you want to keep that cascade of events. And we don't want people to, it's on another slide, take things to stop the inflammation, like NSAIDs, you know, ibuprofen. You sometimes can take Tylenol, but I just try and, you know, maybe not even ice it, you know. And usually it's not that bad. Did you need an ice?
No.
It was achy,
ached.
yeah,
It
ached,
ached
yeah,
pretty good, but I
yeah,
didn't use
yeah.
heater ice.
So we kind of want to create a little micro trauma, but it's not the worst pain you've ever felt. I'm excited to get more into this, you know, to break down tissue at higher amounts. This is pain in the front of the knee again, hamstring. We've got a lady that's got a hamstring. She tore it, and I'm excited to maybe get into that and break down the scar tissue. Elbow pain. So when I started practicing again, I do a lot of this extension, and I do a technique where I kind of pull my triceps a lot, and I pulled it, and I really tore this badly, and I couldn't push down for a while. I had to kind of, you know, alter my technique. It was first, yeah, and so that was really, I mean, at one point I couldn't open my car door. I'd have to go like that, you know, so it's bad. And so that's when I started getting this machine, and then I did it, and it's the worst doing it on yourself because you like got to hold it over there, but it started to help it, yeah. And so now I don't have any problems with anything extension. So fascial release, you know, that's again scar tissue. We want to get into maybe some weight loss stuff, breaking up cellulite and all that kind of stuff. Achilles tendon, yeah. So if you just think of, I think I got a, yeah, if you think of the body, right? Any joint we can possibly help, you know? Okay. So neck, you know, and then these little joints in here, facets that really get locked up, and sometimes it helps to get that inflammation out of there. Rotator cuff, there's the elbow, golfer's elbow, you know, carpal tunnel, real common, the knee problems, the plantar fasciitis, it's really, we've seen a lot of success with it. It's almost like it's designed for it. Okay. Yeah,
This would
question.
increase
stem cells and collagen?
Collagen, not sure. I'd have to look that up.
Because the ridiculous question is, could you use this for cosmetic stuff?
Like, oh, tighten up, like,
Yeah, because
yeah.
the trauma, the rehealing, whatever. And your really ridiculous
Yeah.
question, does it grow hair back?
I don't know. Yeah, I know. Yeah. I don't know. Maybe, I don't know. Maybe there's someone using it for that, you know? Interesting. You know, I think there are a lot of applications. In my practice, I've like barely scratched the surface. So maybe, I don't know. Yeah, possibly. Because blood flow. Yep. And yeah, there's just a lot of it. All the benefits, really good stuff. Blood flow. So take home, increase blood flow, get the tendons to heal again, increase blood flow, get the stem cells to activate again. Yeah. Yep. There's another one. Yes, one for you, Mr. Science Man, nitric oxide, right? So, yeah, so you're going to increase that. Yeah, membrane permeability, how the membranes kind of can exchange of ingredients across the cell membrane. Release of neurotransmitters, those are like the chemical messages going from the brain to hormones. Growth factors, yeah, good stuff. Okay, that's just some cell stuff. Here we go. This is a cool one. So this is not my case. This is from presentation, some cases. And so calcific shoulder. So can you see that big old, it's hard to see here, but there's a big old calcium. And then here, it's kind of a little bit there, but kind of almost gone. Pretty cool stuff. So breaking down. And so that's about how many treatments? 4 weeks. So they probably did about 4 treatments. So I don't know when the X-ray was taken, if it was right after 4 weeks or after 12 weeks. Let's see. Cool. Okay. Obviously, the earlier you can get the problem, the better it is. But okay, we usually do about 3 to 6 treatments. Honestly, more about 5 and 6. But I do actually 6,000. I'm always overkill with things. We do about 6,000 pulses. Takes about, I don't know, 10 minutes. And the biofeedback, so that's essential. The patient telling you, okay, where it is, where it hurts most, you know. And then also sometimes you have to treat a secondary area, you know. So the shin splints, if that's the issue, you got to maybe also work on you have antagonistic, protagonistic muscles, so you may have to work on the opposite area. Alrighty, and pretty good. This is all in the research, different percentages of success. So that's what Journal of American Medical Association, AMA, or Journal of the AMA, foot and ankle, orthopedics. Yeah, good stuff. That's why you're starting to hear about it more. And then just a few popular places. Mount Sinai, you've probably heard of that. You know, John Hopkins, Cleveland Clinic, they're all using that. And then to date, I haven't done a lot of like acute pain. At first, I don't want to be like inflict pain on people, and so we've also got other treatments like microcurrent. So what I usually do is I work on alignment first, try and improve the biomechanics of the joints first. If that really helps, then that's all we need to do. Sometimes I add microcurrent, which is a different type of frequency, and that sometimes heals things. If that doesn't work, that's when I really go to Shockwave. It's kind of like bringing the big gun. So I have kind of a scale it up, you know. Okay. It's like those little nagging injuries that, you know, a little foot pain is really good for. But I also have to find out if they're candidate for it. Okay, and what we do is, we put on gel. So we put, like initially the person sat in the bath and they did the sound waves in the bath because it transmits the sound waves. We don't do that, but we use ultrasound gel. It forms like a barrier, and so the sound waves can kind of move through. And if it doesn't, it just doesn't work as well. It's interesting. So we put a good amount of, and when we're doing it, sometimes you hear pops and whizzes, and sometimes even splatters a little bit. So yeah. And this treatment definitely, like the microcurrent, you don't really feel it. People are like, is it really working? This, you definitely feel it, you know. But people are like, oh, that's working. So, okay. And so, yeah, so we don't want people to take anti-inflammatories because we want the cascade of inflammation. It's almost like there's a little inflammation, body goes in, tries to heal it, and then it gets a little bit better, then we do another treatment, and so it's kind of keeping that, stimulating that healing. Okay. Then also, yeah, setting the right expectations, you know. Not every treatment works 100%, right? It's like often I say, you know, but I think we're starting to get some good success with it. But maximum effect is about 3 months, people notice. Okay. And then we have different attachments for different areas, a big attachment for muscles, and we'll probably use that for like cellulite and things like that, and tendons. So here's, to wrap up, it's non-invasive, there's no surgical, no side effects, no downtime. You can treat both sides, really accelerates that healing process, and then really high patient satisfaction. And so here's a couple just tendons and that we work on, Achilles tendon. And so here we go. So who do you know that could maybe use this technology? So kind of think of that. And then also, you know, this may be a solution for someone. And then when we buy something, we always think about value, right? Is it valuable to us? And so if you think of these costs, average shoulder surgery is from $6,000 to $30,000, usually more than $30,000. So back surgery also 35, carpal tunnel not as much. Most of these are covered by insurance, right? But who's that? If I have shoulder surgery and it costs $35,000, but I only pay what my copay is $100 or $200 or whatever, we actually all paying for that. Does it make sense? So if we can decrease the amount of surgeries and expensive, you know, treatments, you know, in America, it stands to reason maybe those premiums could be, you know, it's more efficient, right? Kind of like a patient that is type 2 diabetic, you know. If I don't have diabetes, my premiums are actually kind of paying for them because we kind of pool. That's how insurance works. We kind of spread the risk. So if we can generally decrease the cost of medicine and healthcare, you know, that would be a good thing. So that's one of my side passions to try and find ways to save people money, you know, because I think the healthcare system's broken and it's too expensive, you know, like an aspirin in the hospital shouldn't cost, what, $20, right? One aspirin. And so it's like, and it's also, it's kind of bankrupting us. So if we don't change the healthcare system, I think it's going to break. We're number 36 in the world of quality care, but we pay twice as much as the next country in healthcare. Isn't that crazy? If you went to buy a car like a Mercedes-Benz, one of the best out there, it's expensive, but you're going to get quality or whatever it is, right? And so it's like we're not getting the quality we used to, I think, but, you know, that's why there's medical tourism. They go to India and these countries, right? Or Mexico, right? Stem cells, right? And so it's like, but most of these are covered by insurance. We think we aren't paying for it, but we actually are, right? But here we go. You heard of LASIK surgery? Is that covered by insurance? I don't think it isn't, right? And so the eye doctors in the early days, when it came out, they're like, we got this new technique, went to the insurance carriers, they're like, no, we don't want to cover it. And that was actually the best thing, because then it stayed in the free market system, right? And it kept the costs low. And so an eye costs about $2,500. What if that went through the insurance process? How much do you think an eye would have cost for LASIK? Because whenever you get insurance involved and the government, prices go up and quality go down. So it stayed in the free market. Then the eye doctors have to be really good at it, and they also give people deals, right? And so it stays in the free market and it keeps the quality stays high and the price stays moderate. Botox, I don't know if anyone's had Botox. I guess 30 units costs about $360. So it all depends on where you place your value. That's what I'm getting at. So one treatment of acoustic pressure wave costs $150. You may think, wow, that's a lot, but maybe not so much. I don't know, you know. And so if it could save your joints, help the healing prices, I don't think it's that expensive. And you don't lose your work in that. So it's all where you, but going back to like shoulder surgery, that costs all of us about 30,000, right? And so for 6 treatments at 150, that's not too bad. So we're actually saving everyone money.
Well, even to
Yeah.
have insurance cover a surgery, you have to pay your
Right.
however many $1,000 deductible.
And so it's an interesting system, right? We get, we're paying our co-pays and our premiums, right? And then you still have to, pay. It's like, that's an interesting system, right? And so it really needs to be revamped. Okay, I think that's it. So take homes, I'll leave it with this. This is the take home list, That's really the one. So really, yeah. And we want to do more of this and help more and more people. And the ones that I've really done a lot of and success is a lot of foot stuff, knee stuff, not as much, back stuff I've done, neck, lots of shoulder, some wrists, some elbows. So that's kind of, I want to do more, like groin pain. You're asking us about kidney stones or gallstones. I don't know. I'll have to look into that. That would be cool if we can maybe help with gallstones. And one of the organs you can't use it on is the lungs, because what happens is it has to be semi-solid, the organ, because for it kind of or there has to be liquid in it for the sound waves to go through. If there's just air, it almost acts like a barrier and hits it, and then it can damage that. So anything with a lot of air in it, no bueno, not going to work. So lungs, yeah.
Gallstones are also covered in wax. That might
Yeah.
for your
What's that? Oh,
Might block the sound.
yeah. I got to look into that because you just asked me today. I'm like, I'm not sure about that.
I know my mom has needed that help needed
So I mean,
a little bit.
you don't pound on the metal.
no. She doesn't have a. She needs one.
Hopefully doesn't need that.
So yeah.
If she gets this, could it prevent?
It could, it could. And so that's the thing. It's like we're so used in this culture of like, because of insurance, we're only really allowed to hear about certain options, right? Because that's all they're saying, How much, and I'd ask, how much PT has she done? Is she working on the biomechanics or the hips and the knee? No, right? And so it's like, because everything's going like this and wearing out. So we're so used to like, oh, you just need that, It's like the example I use, if someone's hip gets worn out and they need to replace the hip, is it because this one's older than that one? Not, right? Same age, but things were wearing out unevenly. And so what could they have done 10 years before? That's why I'm practicing and preaching more about alignment and doing it for preventative, and maintenance. I used to be kind of scared of talking to patients about that because a lot of people think chiropractors just want you to come back, because it's a money thing. But it's about, now I get adjusted to be better, not just to be out of pain, So it also uses for pain relief. But, when you get to using anything health, like nutrition, you want to use it to be better, to be the best you can, not only get out of a bad situation, if that makes sense. But we all start with a problem, right? And then move to that. So, yeah. But a good question, yeah. But it's like, has she gone, in my mind, I'm like, okay, you got to work on your alignment, you got to work on frequencies, you got to do, and then a lot of people expect to come and just be fixed, it's teamwork.
And if you ask an orthopedic surgeon, you're going to get orthopedic surgery exams.
Yeah, and we all I have my biases as well. My bias is, hey, let's try and get the body to work as best as we can, as naturally as possible, and use certain things to help you along the way. That's my bias. I don't think it's a bad, but then if you hammer everything's a nail or a nail, it's like, yeah, we do have our biases. So,
And have you worked on any bunions at all?
not yet. I want to get into that because I
I got
Yeah.
a couple of sisters that are, they're literally planning on surgery eventually.
Yeah, that's what this fancy word is here, hallux rigidus. That one. There we go. It's like with it, yeah. And so I'm like, oh. And so I haven't, yeah. So I want to get into more complex cases, more, you know.
It seems like you need a combination. You need the brace to pull it.
Yeah, exactly.
And then you bust it up and brace it, bust it up and brace it.
Yeah, and you got to pull it, and we may need to do this, and then forceful adjustments and some kinesio taping, and pulling it. So there could be a lot of this is just not. I think it's multiple things, and it's like a team effort, right? So some things are easier to fix, So this is kind of, but maybe that person also maybe need arch supports, could be that as well. So there's a lot of things. We also do that, So knee pain, the knee pain, the knees in between the foot and the hip, and so you got to look at the foot and that. This is the middle guy. That's why we often have problems because either this is off or the foot's off.
And maybe women need to start wearing
ugly shoes. So sometimes this is a trapped nerve in the forefoot. If you squeeze it, a lot of pain. So that's a trapped nerve. But I'm always like, why is it trapped? What's going on? So some of it's not. The elbow may be misaligned for a long time, so you got to adjust that as well and then heal the tendon. So I think it's not always just a.
I don't know. I'm not a car person, so I don't know analogies very well. There's something wrong in your car, like the rotors are wearing funny.
From the brakes? In the brakes?
Sure.
Yeah.
Where your tires funny.
Yeah.
Just go and get new tires.
Mm-hmm.
But you don't fix what caused to wear the tires funny in the first place.
Just
your
put in.
Tires are just going to get worn funny again.
No, you don't work on the alignment. You just work on the tire. Exactly.
You got to work on the alignment. So what you said makes sense.
So also, biggest take home here is health. Health isn't just an event; it's a process. I think we have a more compromised environment, right? The food supply, they've killed that. And then also we've got toxins out there. We're sitting all day, right? And so we sedentary. And so people are coming in more compromised just because of our modern living. And so I think it takes a lot more effort to be healthy than we used to, Dr. Lafferty, who I kind of took over some of his patients, one of the doctors observed him and he said, "Hey, Dr. Lafferty, how come you got into nutrition?" And he's like, "Well, it's because we come in unhealthier," because he used to just adjust, but he's like got into nutrition because you need to look at that. You need to look at the three areas. You look, is it a structural problem? Is it a biochemical body chemistry? And is it an emotional problem? And then you've got to be looking at those three areas. So health takes some effort, and some people aren't willing to put in the time, but it's worth it. And it takes effort nowadays, I think, most of the time. People that are just healthy all the time, and you may see those people, they don't look after themselves, they eat junk, but they seem to be doing well, they may be lucky, But I think most of us have to work at it. So. All righty, cool. Cool, any more questions? That's it? Okay, great. Okay, thanks very much, everyone. Okay, cool.